New data shows that flu cases have jumped by nearly 61%. The latest Canadian respiratory virus surveillance report released Friday found the positivity rate of tests rose the last week of November to 13%, up from 8% the previous week. There was also a rise in hospitalizations tied to respiratory illnesses, up about 26% week over week. Doctors are advising Canadians to get their flu shot this season for the best chance at protecting yourself. Let's bring in Dr. Isaac Bogoch, infectious disease specialist. Hi, doctor. Good to see you. How alarming is this jump in cases?
I think it's expected. It's flu season in Canada. We have this every year. We're going to continue to have this every year. It's influenza. Of course, there's other respiratory viruses circulating, but right now the dominant one is the flu. And we know the flu can pack a punch. It's a nasty infection. It's not just a little sniffle or a little cough or a cold. It can be a very severe infection. And that's why not only are we seeing widespread influenza in the community, we're also seeing the corresponding rise in cases in hospital as well.
And we're hearing warnings that this flu season could hit particularly hard. What are the biggest concerns?
So it's probably true. We look to the Southern Hemisphere as an imperfect barometer of what our flu season is going to look like. And they had a very tough flu season, for example, in Australia. The reason is because it's not just one virus that circulates. There's actually 3 influenza viruses that circulate. And in years where we see more H3N2 flu, those years tend to be years where we see a more challenging year, more patients in hospital, and at a community and a population level, more significant illness. And this year is an H3N2 predominant year. The other reason is because the vaccine, which is comprised of 3 components to protect us against all 3 circulating strains, the H3N2 component is not as good a match as we would like. Does it work? Yes. Does it work as much as we would like it to? No. But it still has some efficacy. And of course, there's protection against the other circulating 2 influenza strains as well. So it's still a very good idea to get the flu shot. But that's why, and yet another reason why we might have a more challenging flu season this year.
And some experts have said the vaccine may not be an ideal fit this year. What is your advice surrounding that?
Okay, so it's extremely important that even though it's not an ideal match, that doesn't mean 0% protection. And it's extremely important that people get their flu shot. It's available, it's free. You can get it just about anywhere in Canada, at family physicians' offices, at pharmacies, at public health clinics, and people 6 months of age and older can get it. It's a very smart idea to get. I think anyone watching who's had the flu, who's been walloped and on their couch for 2 or 3 days knows how significant this is, and especially how severe that could be in an elderly or medically frail individual, and also, of course, in a toddler or an infant or a pregnant woman or someone with underlying heart or lung conditions or who are immunocompromised. It can be especially severe in those individuals, but anyone can get walloped by the flu. It's a great idea to go and get the flu shot.
All right. Thank you very much, doctor, for this. Good to see you today.
My pleasure, Renee. Thank you.
Take care. That's Dr. Isaac Bogoch, infectious disease specialist.